Hello everyone, welcome back to my channel. Today we are diving into a very important respiratory emergency. It is nothing but pneumothorax. This condition can rapidly cause collapse of a lung and become life-threatening if not recognized early. So let's understand in a simple, crisp and easy, useful manner. Yeah. Coming to empathize, that is, what is pneumothorax simply saying? So pneumothorax simply means air in the pleural space. So normally the pleural cavity has negative pressure which keeps the lung expanded. So but when air enters into this space, the lung recoils and collapses. This can happen spontaneously even after trauma or due to underlying lung diseases. So what are the types of lung diseases? So coming to the types, there are several types. So spontaneous pneumothorax is one of the most important type, occurs without any trauma, and thereby it is further divided into primary and secondary. Whereas the second one is traumatic pneumothorax. It is nothing but injury to the chest wall of lung. Whereas the third one is tension pneumothorax. It is the most dangerous type. Air enters but cannot escape, so causing a life-threatening rise in pressure that shifts the mediastinum. Yeah, this is what I was telling before. The presence of air in the pleural cavity causing partial or complete lung collapse, that is said to be as pneumothorax. So what is the clinical features? Clinical features is nothing but the signs and symptoms. Patient may present sudden sharp chest pain, breathlessness, sometimes tachypnea, decreased chest movement, hyperresonance on percussion, and sometimes diminished breath sounds is also present. Whereas in tension pneumothorax, we will be looking for distended neck veins, tracheal deviation, hypotension, and these signs may indicate an emergency in which the patient needs severe help, something like that. Yeah, this is what I was telling before. Asymmetrical chest expansion, hyperresonance, and even breath sounds on the affected side is also being given. So coming to cardiac consideration, so this is what I've told before, the hypertension and tachycardia, and some patients even might have tracheal shift in which the trachea will be shifting either side. That could be either right side or left side, but it will not be in the center of the place which it is supposed to be. Yeah, it is nothing but the flow chart that explains. So it is nothing but air enters into the lung cavity in which we'll be having which results to lung collapse, and it further results in a reduced ventilation, whereas that leads to reduced oxygen consumption, so that the pressure in the thorax will be increased, and thereby leading to tension pneumothorax as well. Yeah, one more thing I need to explain is, so the diagnosis is nothing but diagnosis mostly clinical but confirmed with x-rays. So chest x-rays will show collapsed lung tissues, absence of lung markings, deep sulcus signs in supine patients, and ultrasound is extremely useful in emergency situation settings to detect lung sliding. Whereas management is nothing but management depends on the severity. So in case if it is a small pneumothorax, often resolves spontaneously with oxygen therapy, whereas if it is a large pneumothorax, it needs aspiration or chest tube insertion. Whereas if it is tension pneumothorax, immediate needle decompression in the second intercostal space. Do not wait for x-ray, that is being done immediately. So the chest tube, that is intercostal drainage, is connected to underwater seal drainage until lung re-expands. So coming to the physiotherapy role, as physiotherapists we must ensure the safety first. So avoid chest physiotherapy during active air leak. Once the patient is stable, once the lung is stable, breathing exercise, expansion exercise techniques, gradual mobility training, these all these together will help to restore lung volume and prevent complications. Yeah, and this is nothing but an MCQ in which answers is also given. That doesn't matter. So pneumothorax is defined as we all know, air in the pleural space, whereas common sign of pneumothorax is nothing but hyperresonant percussion, as we all know. And the third thing is that is tracheal deviation occurs. It is nothing but tension pneumothorax, as we all know, and the absent breath sounds are heard in pneumothorax. That is what we have been discussed in signs and symptoms. So the immediate management of tension pneumothorax is needle decompression. As I told before, it is nothing but in second intercostal space. The risk factor for spontaneous pneumothorax is tall, thin, young male. So this is all about pneumothorax. I hope it would help you. Thank you.